Sarah. Okay, great, thanks, Lubna. So good afternoon, everyone. Like Kara said, my name is Kendra Nixon, and I'm a professor in the Faculty of Social Work and also the director of Resolve, which is a Tri-Prairie Research Center on gender-based violence. And today I'm going to be speaking about qualitative methods. I'm not going to be getting into it in any great detail, and it'll really just kind of be a very basic overview of qualitative methods. Then Lubna will speak on normalization process theory, and then Nicole will finish up our presentation and we'll speak about how qualitative methods and normalization process theory has been used in the ATTACH parenting program. Next. Great, thanks, Lubna. So I want to start with this, I think, a great quote from Albert Einstein, who said, "Not everything that can be counted counts, and not everything that counts can be counted." And I think this really speaks to the value of phenomena that can't be measured, right, using surveys and can't be quantified. But there's such really rich, important information we can glean from people's insight and people's lived experiences. And that's really at the heart of qualitative research. Again, I work in the area of gender-based violence. And just as an example, we could certainly measure, and we do measure, women's experiences of violence using standardized measures such as surveys and other instruments. But they can't really get at women's lived experience, what it really means to be victimized by an intimate partner through kind of quantifiable measures. So we can get a lot of rich information when we speak to women and we ask them for their experiences, right, in their own words. So I think this is a really good quote to begin the discussion on qualitative research. Next. So what is qualitative research? Qualitative research is really about, looking at data, exploring data that is collected using words, pictures and not numbers, right? It's about looking at, exploring data about people's experiences, their lived realities, right? It offers insight into, people's social and emotional and, again, lived experience, that type of phenomena. And it tends to happen in the experiences, it happens in the context of everyday lives. So, in natural kind of settings. So in people's families, in people's communities, in people's workplaces. So it's really about examining or exploring people's life experiences and what interpretation or what meaning they give to those experiences. It's a form of inquiry that looks at understanding complex phenomena and often has or takes a holistic picture or understanding of that phenomena. It's about exploring underexplored areas, right? It's not about testing theory. It's about really exploring things that may not have been explored before, or again, looking at the meanings that people attach to things that they experience. It is about inductive exploration versus deductive exploration. So deductive exploration is about testing theory. Qualitative research is about inductive exploration. So looking at things from the ground up. So what emerges from the data? So for us to be open to what emerges from the data. So that's just kind of an overview of, generally speaking, what qualitative research is. Next, Lubna. So there are many types of qualitative inquiry or research traditions. And I'll mention a few of them here. These are what we primarily use in social work. And I think also within nursing, many of these methods are also used. So for instance, phenomenology is one type of qualitative tradition, which is really about understanding the essence or the meaning of experiences, right? So again, people's lived experiences. Grounded theory is about developing theory, right? Again, kind of what theory can be that emerges from the data, right? And I actually have some references here if people want to look at all of these in a bit more detail. Next. There's also ethnography, which is very common within qualitative research. And again, this is about looking at people within, their social or cultural group or their system. So it again is looking at a holistic view of how people experience their reality in the world around them. And this is where the researcher tends to be immersed in a setting or a particular culture. So they're looking at people's behavior, their social interaction, language, and other cultural artifacts. Then there's case study research, and this looks at really delving into a particular case. So not many cases. So your sample sizes are quite low. So this is when you're kind of almost taking like a 360 degree of a particular case or a particular site. And again, the purpose is to gain a holistic or very in-depth understanding of a particular case. And you might be obtaining this data from multiple sources of information. So from, documents or other historical records, interviews with people, focus groups, that kind of thing. And of course, within case study, context is absolutely critical. Next. There's also narrative inquiry, and it's similar to phenomenology when we're really about understanding people's lived realities. So understanding from people's own words how they experience a particular phenomena, what language they use, what words they use to describe those particular phenomena that they are experiencing or that they are impacted by. And it's also a really good method if you want to gain the voices of marginalized populations whose perspective is often not heard. Lastly, there is the thematic or generic approach, and this is one that I'll probably speak to the most. And I think it is what's used also within the ATTACH program when they were looking at the normalization process theory and how that was incorporated into the ATTACH program. So thematic or generic approach is really not guided by a particular methodology or established theory like the ones that I have just mentioned. It's used primarily because it's flexible and it's feasible, right? If you're constrained by time and financial resources, this is a good thematic approach to use. The other methods of inquiry that I just mentioned can be quite time consuming because there's particular steps that need to be followed and a certain philosophy that needs to be followed. The researcher tends to design it as it evolves, right? You may have to change things as you move through the research process. And again, like other forms of inquiry, it is highly inductive, where the codes and categories and themes emerge from the data. Next. So I just want to speak to maybe a couple of main principles in qualitative research, and that is methodological purposiveness and methodological congruence. The first is really about the purpose of the research. You're only going to use qualitative research methods if your research question is about exploring a topic or about learning more in-depth, rich meaning that people ascribe to things, right? So you are being purposeful, right? The next is the methodological congruence. And this is about how every step of the research process follows kind of a form of logic, or it's congruent with one another. So for instance, your chosen methodology fits kind of your research objectives or your research goals, and how you collect your data, how you analyze your data, all links back to the particular theory and your research question. So there's congruence among all steps of the research process. Next. And I'll just speak a little bit about kind of the general process or stages of qualitative research. And I'll just say that I'm presenting these in a bit of a linear fashion. And depending on the methodology that you will use, again, as I talked about phenomenology or grounded theory, they're not going to occur in a very linear fashion. In fact, it's quite iterative, right? You might be going back and forth. So although I'm presenting them as kind of stages, consider these as maybe just as nodal points that occur in qualitative research, but do not necessarily follow a linear, straightforward fashion. So the first thing is, you're developing your research question. So you may have a particular topic that you want to look at, but what exactly are the questions that you want to explore? The next stage is to identify your sample and how you're going to recruit that sample. So again, you may want to use sampling strategies that are purposeful, right? You are going to a particular group of people because you know that they can give you the responses that I guess the information that you're looking for, right? And you have to make sure that that sample is actually representative. So can they speak to not only the questions that you would like to explore, but are they also representative of others who are experiencing that? Now, this is not the same as generalizability that we use in large quantitative research methods, such as surveys. It is not about extrapolating the findings to a larger group or a larger population, but you want to make sure that it is representative of the group. So for instance, when we do studies with abused women, we often recruit women through shelters. Well, those women or survivors of violence are only representative of those who access shelters. We know that most abused women don't access shelters. So there might be some limitations in terms of how you can kind of extrapolate or extend your findings to women who don't access shelters. You're going to be selecting your sample based on pragmatic reasons. Is it practical? Is it feasible? Are people accessible? You might have a time crunch where you can only, interview for people for so long, right? And it might be very difficult to find some of the people that you are wanting to participate in your study. The other things you might want to consider, again, is transferability and applicability. And this is similar to what I was talking about before, right? Depending on your sample, are those people who are participating in your study, can you transfer the information you glean from them to others who experience that same phenomena? And sample size. Does size really matter? And again, it really depends on your methodology, phenomenology, because you're looking at people's experience in a very in-depth way. You might only have one or two people as your sample. Same with case studies. Because you are doing such an in-depth exploration, it is just too time-consuming and too expensive to have larger samples. But generally speaking, we follow something called data saturation, which means that once you've interviewed a number of people, that you start seeing the same data emerge from those participants. So conducting additional interviews are not going to get you that much more or that different information. So have you kind of saturated the data? And that's what we tend to look for when we are finalizing our sample. And then data collection. There can be a number of ways that we collect data through having one-on-one interviews with people, focus groups, and also reviewing documents. But I'll just say in terms of, interviewing and focus group, the researcher really is the instrument. And I don't think people really fully understand that. So, for instance, a survey might be the instrument. The researcher is actually the instrument. You may follow an interview guide, a semi-structured interview guide, but it's really about the researcher or the interviewer who is performing those interviews, who are speaking with the people, who know to probe additional questions, that kind of thing. So the researcher is actually the data collection tool. And data collection is a craft. people, will hone their data collection skills over time doing, multiple interviews. Next. Once you collect your data, and again, these aren't linear stages. In grounded theory, for example, you're, in true grounded theory, I guess, or in pure grounded theory, depending on who you, what author you're looking at, you might conduct an interview, analyze the data, change your research question, then collect more data, and then analyze, and then go back and forth. But essentially, data analysis means transcribing and cleaning the data for any errors or any information that you can't really hear very well. It may involve member checking, where once you, transcribe and analyze and find codes, you might go back to the participants and say, did I get this correct? Am I missing anything? But really, data analysis is about sifting and sorting all of that data and developing codes and categories and themes. And as you can imagine, if you do a number of interviews, you are getting lots and lots of data, and it can be quite overwhelming. And a lot of people use qualitative software to manage the data. It's not used to analyze the data. Again, the researcher does the actual analysis, but the software helps people to manage the data. So for instance, you might be familiar with Deduce or Atlas or NVivo. You may want to check for inter-rater reliability if you have a number of researchers working on the project, to ensure people are congruent and consistent in their coding. And then the last stage is dissemination and knowledge translation. And this is about getting the information back to the audience. Next. And I'll just conclude by speaking about rigor. In qualitative research, rigor is about quality and verification, right? It's about doing the research consistently and in a transparent way so people can verify what you found. Compared to, say, quantitative research, where rigor is about reliability and validity, those are not principles used in qualitative research. Qualitative research is about quality and verification. So it demonstrates to the reader, to the audience, that the researcher conducted the study in ways that, was it transparent? And so if somebody was to replicate that study, they would be able to kind of follow the same same activities and the same practices. Doesn't mean that they would find the same results, because people's worldviews and people's theoretical orientation will interpret the data in different ways. However, people should be able to glean from reading someone's research that they did it in ways that was, again, as I said, was methodologically congruent and followed some consistent and some sound practices. And so, although you may not necessarily agree with the person's findings, what that person found was transparent, and also you could see is plausible. And I think that is it for me, Lubna. I will hand it over to you.
Okay. Okay, so I just wanted to give my thanks to Dr. Nicole Letourneau and Dr. Kendra Nixon for providing me the opportunity to be a part of this talk. I wanted to start off with a brief introduction to the normalization process theory. The normalization process theory, or NPT, is used to uncover factors that interfere with the routine incorporation of interventions into healthcare. And so the NPT identifies and explains key processes that promote and inhibit the implementation and integration of new healthcare techniques and intervention. Okay, so here is a preview of the next section of the slides. So we will be covering the theoretical underpinnings of NPT, who first wrote about it, and what they intended it for it to do. And then we will discuss some examples of some studies it was used for, and also we will show you some of the narrative notes. Okay, so the NPT was developed originally from a collective set of workshops and included a large number of people. Dr. Carl May, who is the godfather of the theory, is a British sociologist and is a professor of medical sociology at the London School of Hygiene and Tropical Medicine. He explored how innovations become routinely embedded in healthcare and other organization systems. This research led to the normalization process theory developed with Tracy Finch and others. And so the development of the NPT first involved the iterative process of a robust generic theory of implementation. From this, tools were developed to assist clinicians and researchers in thinking through and measuring important elements of implementation processes. Okay, so the NPT, I'm just going to talk a little bit about what actually we mean by the normalization process theory. So the NPT is a sociological theory, generally used in science and technology studies and healthcare system and research. The theory deals with the evaluation of new practices in the healthcare systems, implementation research, social care, and education settings. The NPT is a middle range theory, and it can be used and alongside the epistemological and theoretical perspectives, methodologies, and methods that researchers currently draw on in health and social care research. So now the main goal of NPT is to make an intervention that has been recently developed a part of normal practice. And so the NPT is a theory of implementation that focuses on what people do rather than what they believe or intend, and it has been built up from studies of practice in many different healthcare systems. And so it has important practical applications in understanding and evaluating the implementation processes across a range of settings. So now just to put the things in context, we just wanted to show you this video to give you some background on the implementation science. And as we know that the NPT is the theory of implementation science, it will help us understand the processes by which practices become routinely embedded in everyday life, which is a long-standing concern of social sciences.
Medical innovation is vital for improving the safety, efficiency, and effectiveness of healthcare. Studies show it takes decades for only a fraction of proven medical innovation to find its
Sorry, Lubna, could you unmute? I think we just lost sound. I don't know how that happened.
Oh, okay, so let me just do it again. Wait again, I mean.
Sorry about that.
Okay.
medical innovation is vital for improving the safety, efficiency, and effectiveness of healthcare. Studies show it takes decades for only a fraction of proven medical innovation to find its way into widespread clinical practice. Trying to bridge the enormous gap between what we know works and what actually gets done. To address this gap, implementation science shows how evidence-based strategies can be effectively and rapidly delivered to improve healthcare. By removing barriers, evidence-based interventions can be successfully applied in real-world settings. Solutions like electronic health reminders help us remember to get the preventive care that we and our families need.
Okay. So now we will just talk a little bit about the rationale behind developing the theory. So there are many different theories that have been used in implementation science. For example, the theory of planned behavior, or diffusion of innovation theory, or related frameworks, or the actor network theory. All those theories are useful and they provide explanation for relevant phenomena, propose important research questions, and frame the collection and analysis of data. And so the NPT is one of those. It identifies and explains mechanisms that have been empirically demonstrated to motivate and shape implementation processes and affect their outcomes. According to Carl May, the aim of developing the theory was to create a robust and empirically grounded theoretical framework for understanding implementation processes. Also, the NPT is a new theory, and it is believed that it offers researchers something that has been lacking in the literature, which is a consistent framework that can be used to describe and judge implementation potential, but also, most importantly, to design and improve complex interventions. Therefore, the NPT is a strong candidate framework and motivate researchers, both those designing complex interventions and those designing clinical trials, to consider using it in their research studies. So now we will talk a little bit about the 4 mechanisms or concepts of the NPT. And this is the core of the theory. Now, the core concept of the NPT include coherence that identifies and explains the components of practice, cognitive participation that identifies and explains the people implicated in the intervention, collective action that defines and explains the execution of practice, reflexive monitoring that defines and explains the evaluation of the outcome of practice. And so we will talk about it more in the next upcoming slides. Okay, so now we will talk a little bit about the structure or process of the NPT. Process refers to organized and mutual interaction between agents, that are the individuals or groups, that interact with each other in practice, objects that include practices and procedures employed by agents, and contexts that include organizational structures in which agents and objects are implicated. So now here is the model of the NPT that combines the core concepts and the process of the theory. So we won't go in much detail here, as we will talk about it more in the next slides. So now we will talk a little bit about the application of the normalization process theory. And so we will discuss some examples of some studies it was used for. So the NPT has been used in studies that have been constructed with the NPT in mind, that reflects the characterization of implementation processes in both intervention and evaluation design. Also, some studies use NPT constructs as sensitizing devices to form questions about implementation processes, and related their conclusions back to the predictions of the theory. Others have used it to collect and analyze data inductively in the light of NPT, and then develop an analysis of the ways that different mechanisms work to motivate and shape implementation processes. Also, some researchers used it to treat the qualitative data deductively, as Dr. Nixon was talking about, and use pre-scheduled coding matrices for training and analysis. So now here is the an example of the use of the NPT in the research project. So a question was asked, for instance, at what point in the life cycle of your research did you use it? And the answer was, we use it at the study design stage to inform thinking about what participant groups should be involved. For example, practice administrative staff were involved, prompted by NPT thinking. We use it to formulate questions for our interviews. For example, we were not likely to have asked questions about practices, local policies, if we had not been thinking about or following NPT. We use it to provide higher order category analysis of data generated from an initial thematic analysis. And the other question was, did you initially use NPM, that is the normalization process model, or NPT very prescriptively? How did you loosen up your usage? And the answer was, I would say we used it lightly in the early stages of the work, and in a more significant way as the study progressed. I don't feel we followed it prescriptively. It shaped our thinking along the way. And the other question was, how scary, odd, hard, weird was it to first try and use it? And the answer was, the scariest part was being confident that we understood the intended meaning of the NPT constructs and are concerned that we would operationalize them in an appropriate and meaningful way. So now we just wanted to show you a video clip from Dr. Carl May's talk, who is the godfather of the normalization process theory. So we think it is important to hear from the guy on how the NPT actually has been effectively used to help intervention development and implementation planning, as well as evaluating and understanding implementation processes, including the facilitators and barriers, and when the things went well, and on the other hand, when they did not go well.
NPT tells us quite a lot. And here's that cartoon I told you about, and it's quite telling. So these two guys are looking at that thing, and one of them is saying, it's not high definition anything, it's a window. And I just thought there was a wonderful existential truth in this. A theory is a window. It frames things. It directs our attention to some things and not others. And as it does so, the real risk that a theory brings is a kind of tunnel vision in which only that theory matters and only what that theory demonstrates matters. And the world is a more complicated and interesting place than that sort of view will allow. But on the other hand, there are some things that really do matter. And NPT, as I've said, is all about the work. It's about the work that people do. We make the thing coherent, we bring it all together. I'm going to very briefly just point to three really interesting contexts in which NPT has been used and where people have applied the theory as I've described it. So I'm going to start off with the WISE trial, which looked at self-management of complex intervention, comorbid conditions in Britain. Fantastic piece of work that looked as though it was going to change the face of care and self-management for people with diabetes and those kinds of illnesses. And yet somehow it failed. And it failed a very rigorous analysis using normalization process theory tells us, because it could never get purchased on it could never become truly integrated and workable in the healthcare system. It lost its contextual integration. The nurses who were supposed to implement it didn't think it was a legitimate part of their work. There was no good way for clinicians to pick up what they were discovering. It failed because it was not. It lost its capacity to get people to participate. And when they did, they couldn't take effective action. Whereas the MOVE trial, which is my favourite trial of all time, for reasons that I'm about to make clear, I know some of the investigators. This is a trial of surveillance and screening for domestic violence in the state of Victoria in Australia. And I had met a couple of the investigators very briefly in 2008, and last year one of them sent me an email that just said NPT validated. And they had picked up that work and they carried it forward. And they had shown how if you use NPT not just as an evaluation tool, but to inform the design of your intervention, and focus on things like participation and action, and also the kind of monitoring components that people are involved in. They showed how that would lead not just to a really successful outcome in clinical terms, but in fact, when the trial ended, the nurses who were doing the screening just carried on doing it. They had normalized it into their practice. It had become routinely embedded, and they're still doing it today. And I'm a sociologist, I don't get to do much intervention design, but I was so proud that they used it and that they made it work in that way. I thought that was a really righteous piece of work.
Okay. So now talking about the MOVE trial that Dr. Carl May mentioned in his lecture, we would like to give you some more details about the MOVE model because it aligns with our team's work. The research was conducted in Australia, as he mentioned, and they wanted to examine the known barriers to screening and recommendations of their existing models for screening abused women. And they developed an enhanced model of nursing practice called MOVE model. They wanted to explore the challenges that nurses had in identifying abused women despite receiving extensive family violence training. The NPT was used in the creation, implementation, and evaluation of the MOVE model. So here are some narratives from different core concepts from the MOVE model. And again, they wanted to explore the barriers to screening and referrals of abused women. So when asked a question related to coherence, that is the understanding the MOVE model and family violence work or sense-making work, the team leader said, I think it was just by the more discussion that there was around family violence issues and just becoming more familiar and more confident with your expertise in dealing with these things. When asked a question related to cognitive participation, that is engaging with the MOVE model or participation work, the team leader said, nurses, liked the checklist, even to the point where they didn't. When they didn't have to use it anymore, they decided that they would continue to use. Now, when asked a question related to collective action, actually, that is organizing change and relationships or enacting work, the nurse mentor said, a lot of them would still go their local, a neighboring nurse, because that's who they catch up with more, and it was more feasible to catch up at lunchtime or on the phone or something, because we have those networks in our own little area. Now, when asked a question related to reflexive monitoring, that is assessment and monitoring family violence work or appraisal work, the MOVE team leader said, I'm not sure how many incidences of disclosure the team has even come across in their work. Now, just to summarize this all, these are just some examples of the challenges that nurses face in terms of identifying the and recruiting abused women, and the NPT help facilitate identifying those barriers. So I think that is it for my part of the talk. And now I would like to invite Dr. Nicole Letourneau, who will be talking about the qualitative component of the ATTACH project. So over to you, Nicole.
Lubna. Okay, so yes, I'm excited to talk about the qualitative arm of the ATTACH parenting program evaluation, and really where the rubber hits the road, and we're going to actually be using normalization process theory in the context of qualitative methods to really help us open a window, as Carl May says, to understand how we make ATTACH part of normal practice. We would like to follow the model of MOVE, the one that the MOVE trial that Lubna just described, where nurses carried on doing the intervention. It became embedded in their practice after the trial ended. In contrast to the WISE trial that Lubna also described as, and Dr. Carl May described as being a failure, because while the intervention worked, the nurses who were responsible for the treatment did not think it was part of their work. So when the trial ended, the impact of the trial ended too. So we really want to follow MOVE's example in this. So let's go on to the next slide, Lubna. Thank you. So our objective, and we have two objectives in our ATTACH trial. One is to test the intervention in this new context, which is the quantitative arm of the study. And then we have this qualitative objective as well, which determine the feasibility of the implementation of ATTACH. So we're going to use qualitative methods to evaluate parents, study participants, and healthcare professionals and health service administrators' perceptions and experiences of the ATTACH intervention, the uptake and its fidelity. That is how strictly adhered to the protocol for delivering the program was. We want to talk to them about implementation benefits, facilitators, barriers, and challenges. And we want to know about their thoughts on the new ATTACH e-learning platform. And we will be conducting one-on-one interviews until data saturation using normalization process theory. So let's go on to the next slide. All right, so as I said, the NPT is part of our study design, and which is good to hear is best practice. So our design type, it's an implementation study design methodology called Effectiveness Implementation Hybrid, or EIH type 2 design. It's very fancy, I know, a term, but that's to describe the fact that we have qualitative and quantitative objectives. And our research objectives are addressed with this novel methodology, the EIH and NPT, to test our intervention. And the reason why it's type 2, like I said, is because we're simultaneously testing the intervention and our implementation strategy with the NPT method. Let's go to the next slide. So we're going to be recruiting participants to take part in our qualitative NPT component from those that have already been engaging with us. So we'll conduct those interviews in collaboration with our partner agencies who've recruited the participants. Let's go to the next slide. And we had written in our grant that we would recruit up to 20 parents, up to 20 healthcare professionals, and 20 administrators, up to 60. And that up to is very important because the recruitment will cease once we stop seeing new data. The theoretical data saturation is attained, where we're not finding any new themes or information arising from new interviews. So that's our stopping rule. Our stopping rule is essentially when 3 interviews in a row offer less than 5% new information. Let's go on to the next slide. And so in developing the proposal for this work, we're ambitious in drafting our qualitative interview guide, and we have it ready to go. We have addressed the 4 concepts in the interview guide, including coherence, cognitive participation, collective action, and reflexive monitoring. And in finalizing that interview guide, and the interview process will likely be happening over Zoom. At this point, we've gotten quite used to that. But those interviews could happen in a person's home or in a clinic as well, as suits people's desires. And our patient engagement committee and our community engagement committee will be engaged and review feedback and decision-making for those interview guides before they go out. So that's what we're in the process of doing right now. And we're also going to be pilot testing that interview guide. And then all interviews will be audio recorded once we begin. And they'll be audio recorded and transcribed verbatim with appropriate privacy protections, as is the standard in qualitative data collection, which will be put in place to safeguard participant and personal information. Let's go to the next slide. Yeah, there we go. Okay. All right. And so just referring to those 4 concepts again, just to remind you, these are the categories in our interview guide: coherence, cognitive participation, collective action, and reflexive monitoring. So I'm going to give you some examples from the interview guide about these questions. So let's go to the next slide. These are the questions to do with coherence. So is the attached intervention easy to describe? Last participants, how do they describe it? Is the intervention distinct from other interventions? And that'll be particularly of interest to me. Just find out if health service providers think there's some redundancy, overlap with other programs and services that might prevent them from continuing with this. Does it have a clear purpose for all participants that they might envision? Do the parents who are involved, the healthcare professionals, the healthcare administrators, have a shared sense of purpose of the intervention? Do they all think it's the same thing? What do they think will be the benefits of the intervention? And are they likely to be valued by participants? And will these benefits fit their overall goals of the organization? And you can see how that would be so important to having the health service providers and those agencies just continue on delivering attached after we finish our trial, if they find it benefits them. And if they find it doesn't, we're going to want to know why, aren't we? So let's go on to the next slide. So these are the cognitive participation perception, questions that we'll be asking of participants. So for each question, we'll ask them to consider patient, healthcare professional, and administrators' perspectives. So are the target groups likely to think the attached intervention is a good idea? Not just do they think it's a good idea, the person you're interviewing, but do they think that others that the intervention targets will think it's a good idea? Well, the target user groups see the point. Will the target user groups be prepared to invest time, particularly parents? Will they be interested in taking the time, 10 sessions, 1 hour a week, or 10 weeks? Do they think they want to do that? And training particularly for the health service providers who are being trained to deliver the program. So let's go on to the next slide. And here's some example questions about collective action. So how will the attached intervention affect the work of the user groups, like the healthcare professionals in the agency? And again, our user groups are the patients/parents, the health service professionals, and the health service administrators. Will this attached intervention promote their work or impede their work? Really the important question. I'm looking forward to hearing what they say. Well, what do the staff think about the nature of the training? Do they think it's extensive? The training takes there's an online component, the e-learning component, plus there's the in-person component. Do they think that's extensive? And how might we make some adjustments there if needed? How compatible is the intervention with their existing work? And what impact will the intervention have on the division of labor within the organization, the resources they have, responsibilities of different folks in the organization? And will the intervention fit with the overall goals of the organization? So all great questions. Let's go on to the next slide. Reflexive monitoring. Again, so how are you, with respect to reflexive monitoring, how are users likely to perceive the attach intervention once it's been used for a while? Is it likely perceived as advantageous? Is it clear what effects the intervention has had? And I'm really looking forward to seeing that, because I often hear from our facilitators, oh my gosh, we had such an impact. I'd like to see if we're seeing that again here now in this trial. And can the intervention be adapted or improved based on experiences? So those give you examples of the questions in our interview guides. So let's go on to the data analysis and qualitative, the qualitative data analysis slide next, please. Yeah, so our analysis will occur in two parts. First, our interviews are going to be transcribed, like I said, and then those transcriptions are going to be, particularly, it's going to be Lubna likely doing the interviews and along with some students, and we'll also have various team members doing that transcription. But it's going to be really important for us to meet, the team leads, to meet with those folks doing the interviews, the coding, the transcription, because we want to get a sense of those exciting nuggets that are really, oh, we really should pay attention to this that's coming out of interviews and maybe make some adjustments as we go. So this is the idea of finding nuggets even before we've done the analysis. And then systematically we'll be doing a deductive thematic analysis where the transcripts will be coded as in the ways that Kendra described. And I think we'll be using some good qualitative software to do that. And we'll be developing themes and sub-themes using codes that come from the interview questions that'll really make sure that we address the research questions that we have. Let's go on to the next slide, Lubna. Great. So as I was suggesting, multiple trainees will code the data and be supervised by me. And we're looking at inter-rater reliability using kappa coefficients, and disagreements between how we code things will be resolved by consensus. The sub-themes, once the themes and sub-themes are finalized, the findings will be developed into a report that we'll share with key informants as a validation check. Let's go on to the next slide. And just for those who might be wondering, we do understand that this would take time away from people's work and family lives, and significant commitment, probably an hour for interview, maybe a little more for interviewees to go through this process. So we're going to be providing gift cards to everyone who participates, regardless of who they are, to thank them. Let's go to the next slide. And so the implications of this approach is that we stand to understand the feasibility of our implementation strategy by getting insight from our partners in these naturalistic community settings where we're currently testing attach. And we stand to make an impact on policy and practice by promoting the normalization of attach with scale and spread to multiple community agencies, which is really our aim. Let's go to the next slide. Just really the slide to wrap up. We started with a quote. We're going to end with a quote. And Carl Rogers, who was a psychologist and among the founders of humanistic approaches in psychology, particularly the client-centered approach in psychology, which is very much aligned with what we're trying to do here. He said, "We think we listen, but very rarely do we listen with real understanding and true empathy. Yet listening of this very special kind is one of the most potent forces for change that I know." And I was really grateful to Lubna for finding this quote, because it really sums up so well what we're trying to do here. We want to listen carefully, using best methods that we can find. We want to listen carefully to the people who've been involved in helping us to deliver attach in the community, and find out from them what we can do to make this a valuable part of their practice in the realest way, so that we can have an impact over the longer term. So with that, I guess we'll go to the next slide. And we will stop there and are happy to take questions.
Thank you very much. That was an excellent talk, guys. Thanks again. We have a couple of questions coming in. I am going to be a brat and take advantage of the fact that I have the mic, and I'm going to ask the first question if I can. Out of curiosity, so a lot of the stuff that we covered was more using, you're drawing themes and stuff from the raw data instead of coming in with some ideas. Can you talk a little bit about what context it would be acceptable to have pre-existing codes that you're using to analyze the data? Or is that a questionable practice regardless of what you guys are, yeah?
Start with that, and then I'd love to hear what Kendra has to say. But I mean, we're one thing about NPT and the approach that we're using in qualitative methods, you know, just a generic thematic analysis, it's very pragmatic. You know, if I was going to steep both of those in a tradition, a philosophical tradition, I'd say probably pragmatism or something. But so from that perspective, I think, I'd love to hear if Kendra agrees, I think it's appropriate. We really want to know, for example, some of these, as I was sort of reading through some of those example questions, you've got a sense that some of them are about barriers and facilitators and people's attitudes toward the intervention that we then might need to know about so we could make, you know, address. So our a priori codes will definitely be in those areas because and if we didn't put those a priori codes in there, we might miss pulling that out in the most meaningful way, in the most pragmatic way. So that's my answer. I'd love to hear what you think, Kendra or Lubna, and now that you're an expert in this.
No, I agree with that. I think, yeah, you can certainly have codes kind of, you know, understanding what your research question, right? And you're going to know what some of your codes are, right? I think somebody asked a question about what is an example of a code, right? So again, I kind of work in the area of violence. So a code would be related to violence, right? That would be, you know, physical violence, sexual violence, emotional, coercive control, that kind of thing. And your broader categories might be violence. But again, you know, the codes are really dependent on kind of what your research question is. So those are some examples. Lubna, I don't know if you have a more specific response to the ATTACH program in terms of coding.
Yeah, I think it will be mostly, I mean, because we're looking at the barriers to implementation and also the facilitators to the implementation. So I think the codes will be related to, I mean, to those concepts or those, I think, yeah, those two things mainly. And also the codes could be related to how they're perceiving it. And then also the codes could be related to, I think there's one more thing that we wanted to look at. I mean, I think it was the e-learning platform too, but that's something that comes up later on. So I think it's mostly the facilitators and the barriers. This is what I'm thinking.
Yeah, and I'll just want to say, you know, coding is something that, you know, you're going to refine. So, you know, you might start off with one code and then you're going to refine it into something else. You know, the codes aren't static at all, right? And in fact, kind of the process is you're going to do a first level coding where you're pulling out those more obvious codes, right? And then as you're, you know, analyzing across a number of interviews, you're going to revise those code. And that's when you kind of get into that second level coding where you're bringing more abstract ideas in and you start comparing and contrasting. And so your codes change all the time. They are refined constantly during the entire data analysis process.
Can I ask a question?
Go for it, Simone.
Okay, that made most of the sense to me, but I guess because I understand coding from education. So code 44 means this, it means a title, it's a number that equals this title that explains a diagnosis. So that's what I'm referring to. I think that's what you mean by a code. When you have something that's very complex, how do you code it? Are you going to have 10 codes on that pieces of paper that says this? You know, when you're talking about violence as an example, are we saying that, you know, when you describe it in that way, it contextualizes a lot of the narrative? So that's where it's a little tricky to understand the application. I'm curious about the narrative part of this type of research where the story kind of gives or gets meaning. And so I'm just curious between the connection between coding and narrative. I guess it's best as I can describe my inquiry.
But again, and then I'll turn it over to Kendra to give the definitive answers. But coding, what we're talking about here is very different, and it's great. I'm so glad you asked the question because I've been in other meetings where, you know, we say the word coding and they're talking about computer coding, right? So coding means different things in different contexts all the time. And so, yeah, great question. Maybe we need to come up with new terms, you know. But what happens is we interview a parent, like say we'd ask you, Simone, we'd say, what was your experience with ATTACH? And you'd say, well, I really liked it, but I had these few problems with it. And, you know, you tell me a story and then we ask you more questions and we get this big, long interview with you. Because you might go through this. So I'm kind of giving you, this is really good heads up for you. And when we say coding, we mean we thematically end up analyzing what you tell us. So when I say, what did you like about Attach? You might say, well, I liked it was the one-on-one with facilitators. I liked that I learned about my baby. And so those things that you say become codes. Things that you liked would be the head category. And then you'd have a subcategory, which would be, I enjoy talking to the facilitator connection, we call it. And the next one about, learn about my baby, we call it learning about baby. And we end up taking, your nice paragraphs of what you say and turning it into a little tiny meme almost, for lack of a better word. And then that becomes how we code your interview. And then we do that with everybody else's interview, and we'll ask them the same questions, and they'll say things that they like that you didn't think of or you didn't care about or whatever. And then we add that to that header, which is things that people liked about Attach. And it's just, that's what we mean by coding. So
Okay, so it's kind of contextualizing the responses so that you can get the sense of data saturation when you're like, everyone's saying a certain kind of feedback, then you can figure out what's really separate. As you said, the nuggets, the separate part where you can contextualize that separately, and then the others that sort of saturate the general overall feeling of the program. And that's what you mean by coding. Okay, that really explains it for me. That helps a lot because that's part of understanding how the narrative gets used. Okay, thank you.
Yeah, and just to add to that, like your codes are really the most basic unit of your data analysis. So you'll have codes that are part of a larger category. And then the categories, I guess if you can consider it kind of like almost like, I don't know, like a triangle, right? Where you have all of these codes that fit into broader categories. And then those categories fit into kind of these broader themes. And that's really what gets into kind of your narrative, right? So what is the meaning? That's when you're kind of getting into kind of, the overall themes, right? And then you kind of can compare, like this, participant said this positive thing within this context. And it might be different from the other participant because they experienced it in a different context, right? So yeah, I don't know if that really answers your question. It's not so much the codes that will get to the narrative piece. It's connecting those codes within larger categories and then finding out the broader themes, right? I don't know. Yeah.
No, that does actually make sense. It makes sense how you contextualize it in the bigger picture, in the sense that after that, it's kind of retransferred back into the theme of how let's say this particular study is understood or implemented and how it's actually been effective, and just that kind of what comes back to you, because you don't know initially when you put something out how people are going to receive it. So you're right. It does then translate into because it's like the detail work to get the bigger picture. It's like putting all the little pintills of color together. I don't know, that's what makes sense to me, all the little pictures of color, and eventually you get a picture.
Yeah, absolutely.
Like if you're done paint by color, that's sort of what it reminds me of, is all the little codes equal something we see at the end. Is that the theme?
Yeah. And then also, like when you kind of disseminate the information back to people, not only are you going to be explaining what the categories are, you're actually putting people's quotes in too, right? So people's direct quotes. So that kind of explains what you're presenting, right? So, 5 participants said they found the program particularly positive, in such a sense, whatever. And then you might have 3 or 4 quotes that back that up. And so again, you can see the narrative from people's quotes too.
Okay, yeah, no, that explains coding quite extensively. Thank you, ladies. I really appreciate understanding it fully.
All right, awesome, thank you. Now I don't see any more questions in the chat box, and we're right at the end of the hour. So I'm going to sneak in here and say thank you very much. I want to make sure we get finished on time today. So again, big round of applause. Thank you again, Kendra, Nicole, Lubna, for doing our presentation. This is again wonderful. We are going to be posting this on the Attach Teachable website. I did put a link to there in the chat. So if you want a link to the website, all of our other ones are also available online. So if you missed anything or you want to see what else we've covered for content, you can go there. I also want to encourage you to keep an eye out for the May Attach webinar series. So again, last Friday of the month in May, where we're going to have representatives from the community agencies who are involved with the Attach study, and they're going to be introducing themselves and what they do, as well as how Attach will be fitting into that as well. So another interesting talk at the end of May, and I hope to see you all there. So yeah, thank you very much.
Thank you. Thanks, Lubna.
Thank you.
Kendra.
And thank you.